So what this tablet does is I'll set this up in front of you. This allows us to talk to the doctors at St. Joe.
Oh, wow.
Face to face.
Wow. So I will be able to see them over at St. Joe?
That's right. They're going to call us up here in a second, and then we'll be able to see them, and you'll be able to talk to them just like they're in the room with us.
Good morning, Mrs. Voss.
The Remote Specialist Visiting Providers Program, or RSVP, was developed by St. Joseph Mercy Oakland in collaboration with local municipalities to provide additional support to patients as they transition to home recovery. St. Joe's strives to provide exceptional quality care for our patients in the hospital and aims to continue that support after discharge. The program sends trained paramedics to the patient's home and uses secure video technology to connect with St. Joe's providers to address specific healthcare needs and supply the knowledge and the resources to support home recovery. During the RSVP program visit, the visiting paramedic checks blood pressure and conducts a health assessment, reviews and answers any questions about discharge instructions, reviews medications, and ensures the correct dose is being taken, and coordinates a secure two-way virtual consultation using computer technology with a credentialed provider.
What our RSVP program is a way to help patients transition in their home recovery. When you're in the hospital, you may be seen by a variety of physicians and go home on a bunch of medications you're not familiar with. So this program allows us eyes in the home with the paramedics and a link for the patient to somebody at the hospital to help transition through any barriers that they may encounter that hampers their recovery at home.
This is a program that we see the impact immediately. They know they have a resource in the community that they can call upon at any time that will solve their problem.
The RSVP program uses video conferencing technology to support patients in their transition to home recovery. It's a secure, HIPAA-compliant platform allowing a patient to communicate with healthcare providers in the comfort of their own home.
Boy, that was really easy.
The hospital actually comes into their home. We go over their medications to make sure that their medications is reconciled with what the discharge plan was. We make sure they understand their discharge plan.
The technology is very user-friendly. It's a quick dial up to the hospital, and all our medics have been through an additional over 20 hours of instruction from the doctors and staff at the hospital to train us what we would see, more on not so much the emergency portion of it, but what to be looking for now that they've been discharged. Any redness in the area of the wound, anything like that. And the doctor can see the patient and say, look a little pale, what was the pressure you had? You know, they're always constantly checks and balances.
What we have found is patients absolutely love this program. It's designed to help them with their medication reconciliation and understanding what they need to take at home, to help with follow-up visits with their physician, and to do an assessment after the patient is discharged from the hospital. Oftentimes, patients will be readmitted in a way that could potentially be avoidable. And we found this to be an innovative way, using not only technology as a way of assisting patients, but a way of assessing them and making sure that their needs are met.
Frequently, when you're in the hospital, the only thing on your mind is getting home. So you get discharged from the hospital and you get there and you think, now what do I do? What am I supposed to do with these medications? What physicians am I supposed to see? And we help close that gap. In addition to that, the paramedics conduct a home safety check.
We look at their house and we look around and see if there's any hazards there, if the smoke detector is working, if the carbon monoxide is working, if there's trip hazards, if their address outside is visible from the street. And overarching comments we get from the patients is, when are you coming back?
Our personnel would want it no other way than to make sure that they just left somebody who could be their mother or their grandmother or grandfather or father, that they left them in the best shape as possible.
It makes all of us feel good that we're involved in a program that's proactive, that is out and involved in the community, and that we see immediate results, that they are better situated to manage their own health outside of the hospital.
They were so nice and so caring. I was totally blown away by the different things that they were able to do with a stethoscope where the doctor at the hospital could hear my heart. They also had a little pen camera that they were able to go along my incision to see that everything was okay with that. And it was very reassuring. Thank you so much. I'm going to give you a hug. Thank you.
And I would tell any person, Jerry walks in your room, just give her a hug. Be so grateful, because this was exactly what we needed, and we didn't even know we needed it. She was answering a prayer that we didn't even know we had.
The RSVP program works with patients during their transition of care to home by better understanding medications, scheduling appointments, and providing a single point of contact. St. Joe's has a long-standing commitment to use technology to better the health of our patients and to improve their outcome. The RSVP program is another way St. Joe's is caring for the community beyond the walls of the hospital.
Our primary goal is keeping patients safe, not only here in the hospital, but also in their homes.
Definitely recommend anybody to give it a try. There is nothing to lose and everything to gain.
For more information about the RSVP program, call 248-858-6711.